I'm Gallagher. I'm a plastic and reconstructive surgeon with a special interest in gender affirmation surgery. In this video, we're going to talk about how common is it to be transgender, non-binary, gender non-conforming. So when I was in medical school, we were taught that being transgender was incredibly rare, and that, you know, the numbers that were thrown around at the time were maybe 1 in 200,000, 1 in 30,000, depending on which study you read. So if we take a look and see where they were getting those numbers from, basically most of the studies were out of Europe, and what they were doing were looking at the sex change clinics, as they were called back then, and trying to figure out, well, this many people are showing up for their surgeries and treatments out of a population, so that must mean this is how common it is to be transgender. Now, obviously, there's a lot of problems with getting your numbers from that, because as we know, not every patient is going to need surgery, not every patient is going to want surgery, and certainly, particularly back then, not every patient had access to surgery socially, culturally, financially, or for whatever reason. So those weren't the best ways to figure out how many people in a population were transgender. And what we're realizing now is that, in fact, being transgender is a lot more common than we ever thought. And so the epidemiologists are the people who figure out how common things are, and we talk about incidence and prevalence and all those other technical terms. So basically, they figure the best way to figure out how many people in a population identify as transgender or non-binary is to ask all the population and have patients self-report it. So there are a few large studies now done in the United States, and what we're finding is, again and again, replicated in different parts of the country, that being transgender is a lot more common than we previously thought. And so right now, the number stands at between 0.3 and 1.5%. So most people will go for a kind of more conservative number, which is about 0.6, so 6 in 1,000 folks who identify as transgender. So that's a lot higher than certainly I was taught in medical school. And in fact, that's just as common as type 1 diabetes, for example. So, you know, this will probably tell you why there's a huge lack of services for folks who need medical and surgical treatments. And thankfully, with this data now being produced, and different medical professional organizations, third-party peers beginning to understand the huge need that's out there, hopefully we'll see better planning, better education of physicians and other providers, and better care and service for our transgender community in the future.